Good afternoon, folks. This afternoon's topic A, discussion A, explains what the role is for hospice care and hospice nurses. So here we go. Hospice nurses play a vital role in end-of-life care, providing compassionate support to patients with terminal illnesses. Their primary focus is on enhancing the quality of life, ensuring dignity, and offering comfort during a person's final months. Hospice care is typically initiated when a patient has a prognosis of 6 months or less. But contrary to common misconceptions, it does not mean stopping all treatments. Patients can still receive care for symptoms like nausea or infections, though they do not undergo treatment specific for their terminal diagnosis. Hospice nurses work around the clock, offering medical, emotional, and psychological support, not only to patients, but also their families, guys. Okay. Their duties include managing pain, addressing medical needs, monitoring vital signs, and delivering holistic care. They also educate families about what to expect, how to cope with the initial shock of end of life, and and provide guidance on handling practical aspects like medication and bathing. Hospice nurses coordinate with healthcare professionals and remain available to offer comfort during a patient's final moments. Hospice nurses undergo specialized training to provide compassionate end-of-life care. To become a hospice nurse, individuals must first earn a nursing degree, either an associate degree in nursing administration or a Bachelor of Science in Nursing BSN. While both degrees qualify nurses for the Nexus exam, RN exam. Okay. Many employers prefer BSN, prepared nurses, especially for hospice care roles. After passing the NCLEX RN exam, nurses must obtain RN license in their state, which grants them the legal right to practice. Once licensed, Once a license is granted, experience in palliative or hospice care is essential as it helps nurses develop the skills needed to support patients and families during end of life care. Many hospice nurses pursue certification such as the Certified Hospice and Palliative Nurse or CHPN credential, which demonstrates expertise in hospice and palliative care. To earn this certification, nurses must meet specific experience requirements and pass an exam. Okay. Okay. Administered by the Hospice and Palliative Crediting Center, or HPCC. Additionally, organizations like the MUHS Palliative Institute and National Hospice and Palliative Care Organization, or PCO, offer specialized training programs to help nurses refine their skills. Hospice nurses face unique set of challenges. They require resilience, compassion, and adaptability. Some of the most common difficulties include emotional toll. Providing end-of-life care means forming a deep connections with patients and families only to experience loss repeatedly, managing grief while maintaining professionalism can be emotionally exhausting. Suffering staffing shortages. The demand for hospice nurses is rising, but staffing shortages make workloads heavier, leading to burnout. Regulatory and documentation burdens. Hospice nurses must navigate complex regulations and extensive documentation requirements, which could be time consuming and stressful. Okay, ethical dilemmas. Nurses often face difficult decisions or such as balancing patient autonomy with safety concerns or addressing family conflicts over care choices. Misconceptions about hospice care. Many people mistakenly believe hospice means stopping all treatment, making it challenging for nurses to educate families and ensure patients receive appropriate symptom management. Work-life balance. Hospice nurses frequently work irregular hours, including nights and weekends, to provide continuous care. which can make maintaining a personal life difficult. Despite these challenges, many hospice nurses find their work deeply rewarding, knowing they provide comfort and dignity to patients in their final days. Would you like to explore strategies nurses use to cope with these difficulties? Okay, guys, I'll be back on with B shortly. See everybody shortly for B. For now, Gator Wellness. Take care, folks.